Thank you for joining us today on Buzz on Business. I'm Kevin New from Dollar Bank, and I'm here with Phillip Titterington from the ADAMH board. That's ADAMH board. Phillip, thank you for being here today.
Thanks for inviting me.
I really appreciate it. I'm going to ask the first question that I think is most obvious. What does ADAMH stand for, and what do you guys do?
Well, thanks. Once again, thank you for having us, having me here. ADAMH board stands for Alcohol, Drug Addiction, and Mental Health Board. Okay. So we are a government agency. Every county in Ohio has to have a board. There are about 54 boards in the state, 88 counties, so some boards, some counties share a board. And we're tasked with, really the best way to explain it is we're kind of the public system of care. So we provide and fund, evaluate behavioral health services. So those kind of services that help individuals with mental illness, drug addiction or drug abuse, use, recovery supports. We also try to go anti-stigma. So sometimes, mental health and you get a bad name and then people have that preconceived idea and really, this is a disease. So what we try to do is to make sure that there are good quality, accessible services. So we don't necessarily provide the services. We make sure that that continuum around the county exists.
And you said throughout the county, so as far as you're specific right now to Medina County?
Right. We are Medina County only.
Okay. All right. And then you said you use other people who help you with these services, these other third parties?
Right.
Okay, but that is also specific to Medina County, or again, now all over, depending on where people are located?
Well, the continuum services that we are to provide ranges anywhere from supports to inpatient psychiatric hospitals or residential treatment where people need to go. So Medina County doesn't have like state psychiatric hospitals. We are in regions. So we don't have it in Medina County. We don't. We have a couple different residential placements or residential facilities, but for the most part we contract out. So what we do is we make sure that people have access. People who are unable to pay, we help pay for those. But primarily for the behavioral health, we contract with three major agencies that provide. They're community-based agencies. And what we've been able to do over the last 5 years, 6 years since I've been here in this role is to have Ohio Guidestone, Alternative Paths, as well as Catholic Charities be able to provide the full continuum as best as possible, offer many different services. So when individuals are in need and they want to access our system, they have a choice at this point. So we don't provide the services, we pay for them.
Sure. So what would you say is the biggest struggle that you're dealing with right now?
Workforce.
Workforce
is big. So we have some very dedicated agencies, and with the pandemic, I think we all can agree that there's a lot of things changed with the pandemic, and a lot is mental wellness.
Sure.
And anxiety and fear, just a whole bunch. So
depression.
Absolutely. Yep. Right. And sometimes that triggers. So somebody who's genetically already predisposed, you have these triggers come. Sure. It really so we have the need. The problem we're having is we don't have enough people going into the field, even at a lower end in terms of like in colleges, graduating individuals in the behavioral health field. It's a tough field because really you're working one-on-one with individuals. You see very good highs, but you're also taking in a lot of their challenges and you're personalizing it, so you need some health and wellness as well. And the pay is very difficult. Public system, right? Mm-hmm. So what we're trying to do is work with the state is to be able to get individuals, get people interested, even at a high school level, into the field. So that's our greatest struggle. Several years ago, we had recovery community come to us and say, hey, we have a need. We have individuals who are struggling. They want to get better. They need other types of resources. How can you help? So we've been investing in and working very closely with Hope Recovery Community, as well as Kathy's House. So Kathy's House is a recovery center, recovery housing, I'm sorry. And the good news is for all of you in Brunswick here, is both Kathy's House and Hope Recovery Community with the support of the ADAMH board, have expanded, and they're starting to do more work inside Brunswick.
If anybody needs to contact you or the department, how would they do that?
We have a website. If you go to the website, medinamentalhealth.com, that's our website, and you will see the different agencies that we contract with, the different MOUs. So just to kind of put it in perspective, 7 years ago we had 7 different contracts. Today we have around 40. So we're diversifying. We're providing and purchasing services for the real young, infants, all the way to the elderly, to the seniors, because everybody has some type of need. So if you go to medinamentalhealth.com, you can navigate, go through. You'll have all of our contact information. I have my programming director is actually a certified clinician. So Ms. Shelton is just wonderful. I opened up the office so that people can call. She can help navigate somebody through the system. That's one of the biggest challenges that we had is people in need didn't know how to navigate the system. Mm-hmm. How do I get help? We've heard there's help. How do I get there? So they can contact our office. We invested in through alternative paths. They have the 24/7 crisis hotline. We've expanded that to the crisis as well as the behavioral health helpline. So people can call 24/7 if they're in need, and they can go. They can contact Hope Recovery Community, who are great at navigating them through the system.
Well, thank you, Phillip, for being here. I appreciate it. Thank you for explaining everything to everyone. I'm sure this is a very valuable time for them. So thanks again.
I appreciate it. Thank you.
Thank you. We'll be right back.
If I could be you, and you could be me for just 1 hour, walk a mile in my shoes, walk a mile in my shoes.